The ongoing Adderall shortage is creating a challenging situation for many individuals with ADHD who rely on this medication to manage their symptoms. With limited availability, some may be forced to consider alternative medications, one of which is Vyvanse. If you're one of the many individuals facing this decision, you may be wondering how Vyvanse compares to Adderall and what you can expect during the transition. In this video, we're going to delve into the main differences between these two medications and provide some valuable insights into what to expect if you're considering making the switch to Vyvanse. Whether you've used Adderall for a long time or you're new to ADHD medication as a whole, this video is a must-watch for anyone who's looking to navigate the Adderall shortage and make an informed decision. And who am I to talk to you about this stuff? My name is Sulmanazizmirzamd. I'm a psychiatrist who's board certified in adult psychiatry, child adolescent psychiatry, and addiction medicine. And not only am I a prescriber, but I'm also a client. Wait, please don't sue me for that one. Thanks for the support and watching. Make sure to check out some of our other videos on ADHD, including one that I did recently discussing the impact of the Adderall shortage as a whole via the card above. This one, so yeah. Please remember to like, comment, and subscribe to keep the exclusive content flowing. It really does make a difference. Before we dive into the details, let's start with a brief overview of both of the medications. Adderall is a combination of two active ingredients, amphetamine and dextroamphetamine. It works by increasing the levels of dopamine and norepinephrine in the brain, which help improve focus and concentration. Vyvanse, on the other hand, contains only one active ingredient, lisdexamphetamine. It is a prodrug, which means that it is inactive until it is metabolized by the body into dextroamphetamine. This process occurs primarily in the red blood cells and the liver, which breaks down the lisdexamphetamine molecule into lysine and dextroamphetamine. Because Vyvanse is metabolized more slowly than other medications like Adderall, it has a longer duration of effect. In fact, Vyvanse can last up to 14 hours, which is significantly longer than the effects of Adderall's immediate release formulation, which typically lasts between 4 to 6 hours. In terms of onset of action, Vyvanse may take a little bit longer to start working than Adderall. Because it needs to be metabolized first, it may take up to 1 to 2 hours for Vyvanse to start to take an effect, compared to Adderall's immediate release formulation, which can start working in as little as 20-30 minutes or so. However, some people may prefer the slower onset of Vyvanse, as it can result in a smoother, more gradual increase in focus and concentration. Additionally, the slower onset and longer duration of Vyvanse can help reduce some of the risk of side effects compared to Adderall's immediate release formulation. On the downside, some people may find that Vyvanse is not quite as effective as Adderall for their symptoms. Additionally, Vyvanse may be more expensive than Adderall and may not be covered by all insurance plans. Vyvanse is also only available in capsules as well as a chewable tablet, while Adderall comes in both immediate release tablets and extended release capsules, and there's also a liquid formulation and oral disintegrating tablets, or ODTs. So, you decide to make the switch from Adderall to Vyvanse. It's important to understand that the transition process may take some time and some patience. Here's what you may expect during that switch. Firstly, your healthcare provider will determine the appropriate dose of Vyvanse for you based on your individual needs. This may differ from your previous Adderall dosage, so it's important to follow their direct instructions closely and not to make changes to your dosage without their approval. Remember, the doses are not one-to-one swaps, so don't get stuck on the number or the milligrams that are there. As with any medication change, there may be some side effects that occur during the transition period. Some common side effects of switching to Vyvanse include changes in your appetite, changes in mood, and sleep patterns. You may experience some initial side effects during the first few days or the weeks of the transition, but they should subside as your body adjusts to the new medication. It's also important to stay in touch with your doctor during the transition process and report any changes in symptoms or side effects. They may recommend certain lifestyle changes or adjustments to your medication regimen or dose to help alleviate any discomfort. Additionally, keeping a symptom journal can help you track your progress and provide useful information to your healthcare provider. Here's a few tips to help manage that switch. 1. Keep a consistent routine. Try to take Vyvanse at the same time each day to establish a routine and reduce the risk of having side effects. 2. Stay hydrated. It's important to drink plenty of water throughout the day to help reduce the risk of dehydration, especially if you experience increased thirst as a side effect. In my patients, this is one of the most common effects that I notice. 3. Monitor your symptoms. Pay attention to any changes in your symptoms, including mood, appetite, and sleep pattern. This information can be useful for your health provider to determine how effective the medication is and if any changes are needed. Number 4, don't hesitate to reach out for help. If you have any concerns or questions during the transition process, don't hesitate to reach out to your healthcare provider for guidance and support. Remember, switching from Adderall to Vyvanse is a process, and everyone's experience will be unique. With the right support and the management, it can be a successful and effective and overall smooth transition. In conclusion, switching from Adderall to Vyvanse can be a daunting process, but with the right knowledge and support, it can also be a positive step forward in managing your ADHD. Remember to work closely with your doctor throughout the transition process and to monitor your symptoms carefully. While Vyvanse may have potential benefits for improving focus and concentration, it's important to be aware of the possible side effects associated with using it. By maintaining a healthy and safe medication regimen, you can continue to live a fulfilling life with ADHD. You may end up actually liking Vyvanse a little bit more and end up sticking with it after this shortage ends, hopefully soon. Yikes. Thank you again for watching. If you found this video helpful, please like, comment, subscribe for more information on ADHD and mental health. We really appreciate your support. It helps us to continue to grow and bring you some more interesting